Hi friends, good morning one and all of you. My name is Rasne Somnath, lecturer from Pravara Medical Trust, College of Pharmacy, Shivagaon. My subject is pharmacology and toxicology. We will be discussed about the new unit name, that is drugs acting on blood and blood forming organs. The new unit started in previous lecture name, that is drugs acting on blood and blood forming organs, and that unit contain the 5 chapters, like that is drugs affecting coagulation of blood, and this chapter we will be previously explained. So today I am going to discuss with you, we will be discuss the new chapter name, that is fibrinolytic agents and antiplatelet drugs. Fibrinolytic agents, antifibrinolytic agent and antiplatelet drugs, these points are covered today. So what is the meaning of fibrinolytic agent, what is the meaning of antifibrinolytic agent, and what is the meaning of antiplatelet drugs? All these information regarding to this lecture. So one by one discuss here. Introduction part of the fibrinolytics. Fibrinolytics, it is also known as the thrombolytics. Fibrinolytics, it is also known as thrombolytics. The process of fibrinolysis means fibrinogen that having a lysis. Lysis means dissolution or discard. That is the fibrinolysis. These are the procedure having dissolution of clot occurs as follows. The plasminogen is the inactive precursor present in plasma. Various inactive precursors are present in plasma, and this plasminogen is conversion into plasmin by using various tissue inactive precursor presence. So this plasminogen is conversion into plasmin by using various enzymes, and these plasmin are the degraded the clot dissolution, and that having this plasmin can break down the clot. जे काही बॉडीच्या इंटरनल बॉडीजमध्ये ब्लडचं क्लॉट झालं असेल, त्या ब्लडच्या क्लॉटला कमी करण्यासाठी किंवा त्या क्लॉटला ब्रेकडाऊन करण्यासाठी फायब्रिनोलायटिक्स एजंट यूज केले जातात. फायब्रिनोलायटिक्स, इट इज ऑल्सो नोन ॲज अ thrombolytics, and these thrombolytics agents are the used to break down the clot. That's the introductory part of the fibrinolytics. Then plasminogen is the inactive precursor and present in the plasma. These plasminogen are the inactive precursor, but these are present in the plasma, and these it is converted into plasmin by an activator substances present in bloods and tissue. हे जे काही कन्व्हर्जन झाले प्लाझ्मिनोजन पासून प्लाझ्मिनचं बाय युजिंग activator substances present in blood and tissue, and that plasmin can be break down the clots. This plasmin is having to break down the clots. Plasmin that having lysis the clot, or plasmin that's having the dissolution of the clotting material. So these are the introduction part of the fibrinolytics. Then fibrinolytic agents. All fibrinolytic agents currently in use act directly or indirectly as a plasminogen activators. All the fibrinolytic agents currently used as directly or indirectly as a plasminogen activator, and that having produced lysis of an already formed clot. So they are curative rather than prophylactic action shown these fibrinolytic agent drugs. So that these drugs are the produce curative rather than prophylactic action are the produce. Then they can be injected. This fibrinolytic agent can be injected by intra arterially close to thrombus for localized effect. जर localized effect असेल तर this intra fibrinolytic agent can be injected through intra arterially route to that having a localized effect, and intravenously for generalized effect in multiple thrombi. One or local thrombus असेल तर that having a administration by intra-arterially, but that having a many clot in the body, that having a intravenously injected this thrombolytic or fibrinolytic agent are the administrations, and this intravenously for a generalized effect in a multiple thrombi. So incidence of bleeding is high with intravenous injection as preferably. Then next slide, indications. These fibrinolytic agents are used in various conditions, like that used in myocardial infarction, because that myocardial infarction are the fluids that having a do not supply the blood into the heart, to that having myocardial infarction are the fluids. So the clotting may be present in the veins, so that clotting are the dissolution by using this fibrinolytic agent. Then pulmonary embolism, then deep vein thrombosis, and then peripheral arterial occlusion, that having these fibrinolytic agents are used in various conditions, various disorder, various diseases. So these fibrinolytic agents are used in myocardial infarction for the heart, pulmonary embolism, then deep vein thrombosis means internal bleeding in the veins, so that having treatment by this fibrinolytic agent. Then peripheral arterial occlusions. These are the uses of fibrinolytic agent. Then streptokinase. These are the fibrinolytic agent drugs. These streptokinase are produce the fibrinolytic agent action. These streptokinase is the fibrinolytic agents obtained from these streptokinase are the obtained from beta hemolytic streptococci. These streptokinase are the produced from the or obtained from the beta hemolytic streptococci. These are the bacteria, and these are the bacterial producing drugs that having it's obtained from beta hemolytic streptococci. These are the bacteria, and these bacteria having produced the streptokinase drugs. This streptokinase act as a fibrinolytic agent. It acts as a plasminogen activator and leading to fibrinolysis action shown. Because this drug because it acts as a plasminogen activator and leading to fibrinolysis. Then disadvantages of this streptokinase. Streptokinase कुठून आले? These are the drugs obtained from the beta hemolytic streptococci bacteria. And these drugs are the use. The various disadvantages are appear to the human body. So that is firstly, it is inactivated by antibodies to streptococci present in the body. It is an antigenic and so produce hypersensitivity reaction. These streptokinase are the antigenic substances, and that antigenic substances having produced the hypersensitivity reaction or allergic like reaction are the produced. Then local irritation and dangerous hemorrhage are the produced by these streptokinase drugs, and that it's also having a produce fever because these are antigens. These are the disadvantages of streptokinase drug or streptokinase as a fibrinolytic agent. Then urokinase. It is also having a fibrinolytic agent or thrombolytics agent. This urokinase, it is enzyme prepared from the human urine. These urokinase drugs or these are agent is used. It is obtained from human urine. It is now prepared from culture human kidney cells. It is newly prepared from culture human kidney cells. Unlike streptokinase, these urokinase do not produce the antigenic property, do not produce the pyrogenic activity, do not produce the fever, and does not produce any allergic reaction. So urokinase are the preferably for the streptokinase. Over the streptokinase, these urokinase drugs are the used. Unlike streptokinase, urokinase are the non-antigenic property, non-pyrogenic property, and does not produce allergic reaction. These urokinase are the showing this property. So urockinase are the preferably as a fibrinolytic agents. Then third example, that is tissue type plasminogen activator. This tissue type plasminogen activator, it is the natural protein in man. It is prepared by recombinant DNA technology. These drug or these are agent are prepared by recombinant DNA technology, means rDNA technology पासून these are the proteins or these are the agents are produced, that is tissue type plasminogen activator. It has a selective effect on plasminogen bound to fibrin clot, and systemic activation of plasminogen, and so bleeding is minimized. So it is a safe than streptokinase. त्यामुळे streptokinase पेक्षा tissue type, so it is a safer than streptokinase. त्यामुळे tissue type plasminogen activator, it's a safe than other agents because these are the systematic activation of plasminogen, and so bleeding is minimized. This is the first point, fibrinolytics agent or thrombolytics agent. This fibrinolytics means dissolution of clot. Okay, that having a consist the three drugs or three agent of fibrinolytics agent. Streptokinase, it is obtained from beta hemolytic streptococci. Then second agent urokinase, it is obtained or it is prepared from human urine. And then tissue type plasminogen activator, it is prepared by recombinant DNA technology. These are the fibrinolytic agents. Then now next point, antifibrinolytics agent. Antifibrinolytics agent, these are the drugs inhibit the fibrinolysis. जी काय आता आपण प्रोसिजर बघितली फायब्रोनोलायटिकची, ती प्रोसिजर स्टॉप करण्याचं काम अँटीफायब्रोनोलायटिक्स ड्रग्स करतात. these are the drugs or these are the agent inhibit the fibrinolysis and therefore prevent the dissolution of clot. क्लॉट होण्यापासून, क्लॉटचं डिझॉल्युशन होण्यापासून त्याला प्रिव्हेंट करण्याचं काम ह्या अँटीफायब्रोनोलायटिकच्या ड्रग्सचं आहे. दे ॲक्ट बाय इनहिबिटिंग द प्लाझ्मिनोजन ॲक्टिवेशन. जे काय प्लाझ्मिनोजनला ॲक्टिव्हेट करत होतो आपण बाय युजिंग धिस फायब्रोनोलायटिक मेकॅनिझम ऑफ ॲक्शन दॅट हॅविंग अँटीफायब्रोनोलायटिक एजंट, सो inhibiting the plasminogen activation. So these are the antifibrinolytics agent. These antifibrinolytics agent are the inhibit the fibrinolysis condition and therefore prevent the dissolution of clot. जे काय क्लॉटचं डिझॉल्युशन होत होतं, क्लॉट निघून जात होता, त्याचं प्रिव्हेंट करण्यासाठी अँटीफायब्रोनोलायटिक्स ड्रग्स आहेत. सो नेक्स्ट drugs or agent of antifibrinolytics agent, that is the name epsilon amino caproic acid. These are the antifibrinolytics agent. Epsilon amino caproic acid, it is the structurally related to lysine. The lysine are the amino acid, or this drug epsilon amino caproic acid, it's structurally related to that lysine. This epsilon amino caproic acid, it blocks the plasminogen activation by competitive blockage. This epsilon amino caproic acid block the plasminogen activation by competitive blockage, so it reduce the fibrinolytic activity. म्हणजेच काय तर प्लाझ्मिनोजेनचं जे काय ॲक्टिवेशन होतं ते स्टॉप केल्यानंतर ॲटोमॅटिकली रिड्यूसेस दी फायब्रिनोलायटिक ॲक्टिव्हिटी. Dose of epsilon amino caproic acid, that is initially 5 gram orally or IV followed by 1 gram every 1 hour till bleeding stops. ब्लिडिंग स्टॉप होत नाही तोपर्यंत स्टार्टिंगला 5 ग्रॅम ओरली किंवा IV ड्रग्स द्यायचा आहे, नंतर 1 ग्रॅम एव्हरी 1 hourसाठी द्यायचं आहे. दॅट इज these drugs are used in, it is used to control hemorrhage like this epsilon amino caproic acid. The various uses, it is used to control hemorrhage bleeding like abortion placenta. ज्यावेळेस ॲबर्शन होईल प्लॅसेंटाचा, ज्यावेळेस ब्लिडिंग होईल, जे हेमोरेज होईल ते स्टॉप करण्यासाठी किंवा कंट्रोल करण्यासाठी हा ड्रग्स यूज केला जातो. दॅट इज नेम इप्सिलॉन अमायनो कॅप्रोइक ॲसिड. देन पोस्टमार्टम हेमोरेज. आफ्टर दॅन पोस्टमार्टम दॅट हॅविंग अ व्हेरियस fastly bleeding or hemorrhage, that control can be using this drug administration epsilon amino caproic acid. And then ट्रॉमॅटिक अँड सर्जिकल ब्लिडिंग. जर सर्जिक ऑपरेशन झाल्यानंतर जी काय ब्लिडिंग आहे ती स्टॉप होण्यासाठी हा ड्रग्स दिला जातो. दॅट इज नेम एप्सिलॉन अमायनो कॅप्रोइक ॲसिड टू प्रिव्हेंट दी ब्लिडिंग or to control the hemorrhage. Then next drug, tranexamic acid. It is the synthetic inhibitor of fibrinolysis. These are the synthetic inhibitor of fibrinolysis. Name tranexamic acid. Tranexamic acid are the synthetic inhibitor of fibrinolysis. It is a 10 times more potent. It is a 10 times more potent than EACA, epsilon amino caproic acid. Is 10 times more potent than EACA, tranexamic acid. It binds to lysine binding site on plasminogen, and these it prevent the combination of plasminogen with fibrin. काय होते, लायसिन सोबत बाइंडिंग झाल्यानंतर त्यामुळे काय होणार, प्रिव्हेंट द कॉम्बिनेशन ऑफ प्लाझ्मिनोजन विथ फायब्रिन. It binding this tranexamic acid is binds to lysine binding site on plasminogen that having prevent the combination of plasminogen with fibrin. Dose of tranexamic acid that is 1 gram orally or IV 3 to 4 times a day. That is tranexamic acid. This tranexamic acid are the antifibrinolytic activity show. These tranexamic acid are the synthetic inhibitor of fibrinolysis, and it is 10 times more potent than the epsilon amino caproic acid. Then next slide, aprotinin. Aprotinin, it is a polypeptide protease inhibitor drug. It is isolated from bovine tissue. This is also having a antifibrinolytic agent aprotinin. It is a polypeptide protease inhibitor drugs. It is a isolation from the bovine tissue, and this aprotinin agent inhibit the kallikrein, trypsin and fibrinolysin agent. These aprotinin drugs are the inhibition of the kallikrein, trypsin and fibrinolysin. These aprotinin are the antifibrinolytic agent, and these aprotinin are the isolation from bovine tissue, and that aprotinin are the inhibition of the kallikrein, trypsin and fibrinolysin enzyme. Then sclerosing agent. This sclerosing agent, these are irritating substances used to obliterate varicose veins. They are also used for closure of hemial rings for fibrosing hemorrhoids, and the preparation used are phenol 5% in vegetable oil, and second preparation containing salt of fatty acids like sodium linolate or ethanolamine oleate. What is the meaning of sclerosing agent? Sclerosing agent, these are the agent used in irritating substances used to obliterate varicose vein, and they are also used for closure of hemial rings and for fibrosing hemorrhoids. These agents are the used in preparation phenol 5% in vegetable oil. So then next point of this lecture, antiplatelet drugs. आता अँटीप्लेटलेट ड्रग्स म्हणजे काय, तर इंट्राव्हॅस्क्युलर थ्रोम्बोसिस इज इनिशिएटेड बाय प्लेटलेट अढेजन अँड ॲग्रिगेशन. इंट्राव्हॅस्क्युलर म्हणजे जे काय थ्रोम्बोसिस होतं आहे हे कशापासून होतं आहे, तर प्लेटलेट अढेजन आणि प्लेटलेट ॲग्रिगेशनमुळे. तर प्लेटलेट अढेजन म्हणजे काय आणि प्लेटलेट ॲग्रिगेशन म्हणजे काय ते आपण बघूया. प्लेटलेट तुम्ही ऐकलं असेल, प्लेटलेट कशासाठी पाहिजे, तर ब्लड क्लॉटिंग होण्यासाठी, ब्लड जे काय ब्लिडिंग होत आहे फास्टमध्ये ते स्टॉप होण्यासाठी प्लेटलेट एजंट आपल्याला गरजेचे आहेत. प्लेटलेट स्टिक टू द डॅमेज व्हेसल वॉल. जर एकमेकाला जर प्लेटलेट एकत्र आल्या तर ॲटोमॅटिकली काय होईल, डॅमेज दी व्हेसल वॉल. द प्लेटलेट स्टिक टू द डॅमेज व्हेसल वॉल, दॅट इज कॉल्ड ॲज अढेजन. देन दे स्टिक टू इच अदर. जर त्या प्लेटलेट एकमेकांना स्टिक झाला तर दॅट इज कॉल्ड ॲज दी ॲग्रिगेशन अँड रिलीज दी ॲडेनोसाईन डायफॉस्फेट ADP अँड थ्रोम्बोक्सेन A2 मीन्स TXA2. जर एकमेकांना प्लेटलेट स्टिक झाल्या तर दॅट इज कॉल्ड ॲज दी ॲग्रिगेशन अँड दॅट हॅविंग रिलीज दी ADP अँड TXA2, and these promote further aggregation and also fibrin formation clot. And these antiplatelet drug inhibit the platelet aggregation. आणि हे जे काय अँटीप्लेटलेट एजंट आहे दॅट हॅविंग इनहिबिट द प्लेटलेट ॲग्रिगेशन. ह्या प्लेटलेटचं ॲग्रिगेशन कसं इनहिबिट होईल ते करण्यासाठी अँटीप्लेटलेट एजंट यूज केले जातात. सो दे आर युजफुल इन द प्रिव्हेन्शन अँड ट्रीटमेंट ऑफ थ्रोम्बोसिस इन कंडिशन लाईक मायोकार्डियल इन्फ्रॅक्शन, मायोकार्डियल इचेमिया अँड सेरेब्रल इचेमिया. Prostacyclin PGI2 synthesized in the blood vessel is a natural inhibitor of platelet aggregation. This prostacyclin synthesized in the blood vessel and it is a natural inhibitor of platelet aggregation. Then aspirin, it is also having a antiplatelet drugs. Aspirin काय केलं जातं, aspirin जे काही ड्रग्स आहे that is also having a antiplatelet drugs. These aspirin inhibit the release of ADP from platelets. जी काय ADP प्लेटलेट्सपासून निघणार आहे त्या ADPला इनहिबिट करण्याचे काम हे ॲस्पिरिनचं आहे. ऑल्सो इट इनहिबिट द सिंथेसिस ऑफ प्रोस्टॅग्लॅन्डिन अँड थ्रोम्बॅक्झिन A2. दिस ॲस्पिरिन इट्स ऑल्सो हॅविंग inhibit the synthesis of prostaglandin and thromboxane A2, and all these mechanism inhibit the platelet aggregation. त्यामुळे काय होतं आहे, प्लेटलेटचं ॲग्रिगेशन हे इनहिबिट केलं जातं आहे. ॲस्पिरिन हा जो काही ड्रग्स आहे दिस आर द ड्रग अँटीप्लेटलेट ड्रग्स. म्हणजे ब्लडमध्ये जर क्लॉटिंग झालं असेल तर ते कमी करण्यासाठी ॲस्पिरिन ड्रग यूज केला जातो. मग ॲस्पिरिन ड्रग ज्यावेळेस यूज केला जातो त्याचं मेकॅनिझम काय आहे तर त्यामध्ये तो काय करतो, ॲडेनोसाईन डायफॉस्फेट जे आहे रिलीज केलेलं आहे प्लेटलेटने त्याला इनहिबिट करण्याचं काम करतो. देन इनहिबिट द सिंथेसिस ऑफ प्रोस्टॅग्लॅन्डिन अँड थ्रोम्बॅक्झिन A2. हे जे काही दोन केमिकल्स आहेत ह्यांनाही इनहिबिट करण्याचं काम हे ॲस्पिरिनचं आहे. अँड ऑल धीज मेकॅनिझम इनहिबिट द प्लेटलेट ॲग्रिगेशन. त्यामुळे काय होईल, प्लेटलेट ॲग्रिगेशन याचं इनहिबिट होईल. देन नेक्स्ट ड्रग Dipyridamole. This Dipyridamole, it has no effect on the level of thromboxane A2 or PGI2. PGI2 means prostaglandin, thromboxane A2. हे जे काय दोन आहेत is having no effect on the level of thromboxane or PGI2 on this Dipyridamole. This Dipyridamole drug or agent, it is no effect on the level of thromboxane and PGI2. It acts by inhibiting the phosphodiesterase, which in turn increases the cyclic AMP. That having it acts by inhibition the phosphodiesterase and which in turn increases the cyclic AMP. यामध्ये काय होतं, डायपायरिडॅमॉलमध्ये इनहिबिशन ऑफ द फॉस्फोडायस्टरेज एन्झाईम अँड दॅट हॅविंग इन्क्रीजेस द सायक्लिक अमोनोसाईन मोनोफॉस्फेट इन्क्रीजेस अँड दॅट हॅविंग these inhibit platelet aggregation. त्यामुळे प्लेटलेटचं काय होतं, प्लेटलेट ॲग्रिगेशनचं इनहिबिशन होते. अँड दिस डायपायरिडॅमॉल इज ऑल्सो ॲज अ कोरोनरी व्हॅसोडायलेटर. दिस डायपायरिडॅमॉल, these are the agent or drugs, it's also used in a coronary vasodilators. Then next drug Ticlopidine. This Ticlopidine, it is the new synthetic inhibitor of platelet aggregation. These Ticlopidine are the antiplatelet agent and this Ticlopidine having a new synthetic inhibit the platelet aggregation. It has a no effect on a cyclo-oxygenase or cyclic AMP. This Ticlopidine, it does not affect on the COX-1 enzyme and COX-2 enzyme or AMP enzyme. Means this Ticlopidine is not effect on the cyclo-oxygenase and adenosine monophosphate. It inhibits the platelet deposition, aggregation and release reaction. म्हणजे हे जे काय अँटीप्लेटलेट एजंट आहेत हे आपण यूज काय करतो, जर ब्लडमध्ये क्लॉटिंग झालं असेल इंटरनल साईडला तर ते ब्लडचं क्लॉटिंग निघून जाण्यासाठी किंवा ते रक्त पातळ करण्यासाठी हे ड्रग्स यूज केले जातात. मग ह्या टिक्लोपायडिन काय करतात तर हे टिक्लोपायडिनचं जो काही ड्रग्स आहे सिंथेटिक इनहिबिटर ऑफ प्लेटलेट ॲग्रिगेशन. प्लेटलेट ॲग्रिगेशन म्हणजे काय तर प्लेटलेट एका ठिकाणी येऊन साचणे, म्हणजेच एका ठिकाणी येऊन डिपॉझिट होणे, ॲग्रिगेट होणे किंवा एखादं रिलीज करायचं काहीतरी केमिकल्स, आणि ह्या सर्व प्रक्रिया टिक्लोपायडिन इनहिबिट करतात. टिक्लोपायडिन इट इनहिबिट द प्लेटलेट डिपोजिशन, it inhibit the platelet aggregation and it inhibit the release reaction. So this Ticlopidine drug is used as a antiplatelet drugs. This ticlopidine is also synthetic drugs, and antiplatelet drug having a various drug are the used like that aspirin, dipyridamole, ticlopidine. Then second last drug, clopidogrel. Clopidogrel, it is a congener of ticlopidine. Ticlopidine, these are the drug is used as an antiplatelet agent, and these ticlopidine are the new synthetic antiplatelet agent. And these ticlopidine are the inhibition of the platelet aggregation, platelet deposition, and platelet release formation. And these ticlopidine are the congener with clopidogrel. Clopidogrel, it's a similar mechanism to the ticlopidine. This clopidogrel, these are the agent, are the similar mechanism to the ticlopidine. It is a better tolerated and it produces less neutropenia and thrombocytopenia than ticlopidine drugs. Side effect of this clopidogrel are the side effect following like that diarrhea, epigastric pain and rashes are the side effect of the clopidogrel. Dose of clopidogrel, that is 75 milligrams once daily as a tablet. And last drug of the antiplatelet agent, that is apiximab. These are the monoclonal antibodies, and these monoclonal antibodies of apiximab drug that having inhibit the platelet aggregation effectively. जे काय प्लेटलेटचे ॲग्रिगेशन होतं आहे त्याला इनहिबिट केलं जातं बाय युजिंग दिस apiximab monoclonal antibodies drugsपासून, and that having it can causes bleeding and allergic reactions are produced, and these apiximab are the used in patient undergoing the angioplasty. These apiximab drugs or agents are the used the patient is suffering from undergoing to that angioplasty. These apiximab drugs are the used. So today complete the fibrinolytic agent, then antifibrinolytic agent, and then antiplatelet agent. So thank you so much.